This video lecture is about sulfonamides, the classification, the mechanism of action and some of the combinations of sulfonamides. So to start off with the introduction of sulfonamides, the sulfonamides are structural analogues of PABA or para-aminobenzoic acid, and since these are structural analogues of para-aminobenzoic acid, they are also known as synthetic antimicrobials rather than antibiotics that are obtained from microorganisms. So to classify the sulfonamides that are available, they are divided into oral absorbable agents, oral non-absorbable agents and topical sulfonamides. The oral absorbable sulfonamides are categorized into short-acting, intermediate-acting and long-acting sulfonamides. An example of short-acting sulfonamide is sulfadiazine with a duration of action of 6 to 9 hours. An example of intermediate-acting sulfonamide is sulfamethoxazole with a duration of action of 10 to 12 hours. An example of long-acting sulfonamide is sulfadoxine with a duration of action of few days, that is 7 to 8 days. Now coming to the non-absorbable sulfonamide derivatives, some of the examples are sulfasalazine, osalazine and valsalazine. So these sulfonamide derivatives are very useful for the treatment of ulcerative colitis, a disease of the intestinal tract which affects the large intestine, particularly the colon. Next is the topical preparations of sulfonamides, which include sulfacetamide, silver sulfadiazine and mafenide. Silver sulfadiazine and mafenide are useful for the treatment of skin burns to prevent and treat infections, whereas sulfacetamide is useful for treating eye infections. Next, we move on to the antibacterial action of sulfonamides. The sulfonamides act by inhibiting the growth and multiplication of the bacteria. So it does so by inhibiting the folic acid synthesis. The active form of folic acid is tetrahydrofolic acid, also known as folinic acid. So tetrahydrofolic acid is required for the synthesis of nucleic acids, that is DNA, RNA. It is required for the synthesis of proteins and the growth and multiplication of bacteria. So by inhibiting the tetrahydrofolic acid, the growth and multiplication of bacteria by the sulfonamides is inhibited. So how does sulfonamide inhibit or block folic acid synthesis? Folic acid synthesis occurs in various steps and these are as follows. The para-aminobenzoic acid combines with pteridine moiety to form dihydrofolic acid in presence of an enzyme known as folate synthetase enzyme. Now the dihydrofolic acid gets converted to tetrahydrofolic acid, which is the active form of folic acid in presence of an enzyme known as dihydrofolate reductase. So the two enzymes that are responsible for the synthesis of folic acid are 1. The folate synthetase enzyme and 2. Dihydrofolate reductase enzyme. Now the folate synthetase enzyme is blocked or inhibited by sulfonamides. So sulfonamide competes with para-aminobenzoic acid for the folate synthetase enzyme and blocks folic acid synthesis. Secondly, the trimethoprim, which is another drug, blocks the dihydrofolate reductase enzyme, the second step of folic acid synthesis, and thereby inhibits the synthesis of active form of folic acid, and thereby it inhibits the bacterial growth and multiplication of bacteria. And as we know that bacteria cannot utilize the exogenously administered folic acid, it has to synthesize its own protein synthesis, it has to synthesize its own proteins with the help of folic acid, which is necessary for protein synthesis, nucleic acid synthesis, for the growth and multiplication of bacteria. So to sum up, sulfonamide inhibits the folate synthetase enzyme and trimethoprim inhibits dihydrofolate reductase enzyme. It is a synergistic combination because the combination of the effect is greater than the individual effects of the drug. So it is known as a synergistic combination, and the combination is also known as co-trimoxazole. Now to be noted that there is a third drug which is known as pyrimethamine, which produces action against dihydrofolate reductase enzyme, which is blocked by trimethoprim. So both pyrimethamine and trimethoprim block the same enzyme, that is dihydrofolate reductase enzyme. The point of difference is that trimethoprim has high affinity for bacterial enzyme, that is bacterial dihydrofolate reductase enzyme, and pyrimethamine has very high affinity for protozoal dihydrofolate reductase enzyme. Therefore, pyrimethamine is used in combination with sulfonamides for the prevention and treatment of toxoplasmosis and malaria, which are protozoal parasites. So talking about the combinations of sulfonamides can be combined with trimethoprim, and the combination is known as co-trimoxazole. So co-trimoxazole is a combination of sulfamethoxazole, which is an intermediate acting sulfonamide with a duration of 10 to 12 hours, in combination with trimethoprim acting at different steps in folic acid synthesis. So these drugs are combined with a ratio of 5:1, that is 5 parts of sulfonamide and 1 part of trimethoprim. So if trimethoprim is 80 mg, sulfamethoxazole is 400 mg. So what are the advantages of combining sulfamethoxazole with trimethoprim? Firstly, sulfamethoxazole and trimethoprim, if act alone, have bacteriostatic action, which is inhibition of growth and multiplication of bacteria. But when combined together, they produce bactericidal action, which is killing of the bacteria. So bactericidal action is produced by combining sulfamethoxazole with trimethoprim. Secondly, the combination of drugs produces a wider spectrum of action compared to the drugs acting alone. And the third action is that the combination of drugs delay the development of bacterial resistance. So the other combinations of sulfonamides are sulfadoxine and pyrimethamine, which is a combination that is used for the treatment of chloroquine resistant falciparum malaria. This combination is in the ratio of 20:1, that is 20 parts of sulfadoxine combined with 1 part of pyrimethamine. We have learned that both sulfadoxine and pyrimethamine are long-acting drugs, but when combined together, they can act faster. Now, there is another combination of sulfonamide derivative, that is sulfadiazine combined with pyrimethamine for the prevention and treatment of toxoplasmosis. So to sum up, there are 3 types of synergistic combination. The first combination is sulfamethoxazole and trimethoprim, which is also known as co-trimoxazole. The second combination is sulfadoxine and pyrimethamine, which is used for the treatment of chloroquine resistant falciparum malaria. The third combination is sulfadiazine and pyrimethamine, which is used for the treatment of toxoplasmosis, which is a protozoal disease. So we have discussed the classification, the mechanism of action, and various synergistic combinations of sulfonamides with pyrimethamine and trimethoprim. So if you find this video useful, please like and subscribe to this channel. Thank you for watching.